Future Mart stores are temporarily closed. Shop online anytime at nfm.com.
This is breaking news from KETV Newswatch 7 and KETV.com. Good afternoon, everyone. I'm Julie Cornell. Hope you're having a good day. It's time again for the daily news conferences from the governors of Nebraska and Iowa. Pete Ricketts is just beginning in Lincoln.
Well, good afternoon, everybody. Thank you very much for being here this afternoon for our coronavirus update. I'm being joined today by Heath Bodie of the Nebraska Healthcare Association and Todd Stubendijk from the AARP, and they'll be talking in a few minutes. Just to bring you an update on some of the things that we've got going on here in the state. First of all, we have issued 2 new DHMs, one for the Panhandle Public Health District, which includes 12 counties. That we did last night, and that DHM that directed health measure will last till May 11th. We did another one today that will be for the South Heartland. That will be 4 counties, including Webster, Adams, Nuckolls, and Clay County, and that will also go through May 12th. And just a reminder, when we do these directed health measures, these are more restrictive than the general statewide one. So we are looking at, for example, restaurants closing to dine in. We're looking that bars have to be closed. They can do package, takeout, or delivery. Same thing for restaurants. They can do takeout, carry out, delivery, but no dine in. We also prohibit selective surgeries and a variety of other things that go into that as well. So those are 2 new DHMs. That brings the total number that we have here in our state up to 34 counties. As of a little bit ago, we have 172 cases that have tested positive here in the state of Nebraska, 3,111 tests. So that's about a 5.6%, I think. Isn't that about 5.6%? It's 5.3, 5.6 in that area. 5.3. Thank you, Dr. Antone. So 5.3% of the cases that we are testing, and remember, these are the high-risk cases. These are people who have either been traveling or they've been associated with somebody who we know to have the coronavirus, or they presented to a hospital with severe symptoms and so forth. These folks are the high-risk cases. We're still testing about 5.3%. And to put that in perspective, when we were on the phone call yesterday with the mayor of Washington, D.C., she is testing at about a 12% rate with her high-risk cases, or just in general of their cases. So just to put in kind of perspective of where we are here in the state of Nebraska. This is all a great reminder to tell people to continue to pay attention to that social distancing. That we need people to make sure, again, if you are displaying those symptoms of high fever, cough, shortness of breath, stay home immediately, and especially if you're in one of our DHM areas, everybody in your household needs to stay home as well. Contact your healthcare provider. Do not just go into an emergency room. Call and make an appointment. Do not just go into a doctor's office. Call and make an appointment. And they will make sure that they keep you isolated until you can be tested to make sure you don't have regular flu or something like that. And again, if you fall into one of those high-risk categories, we will then get you tested appropriately as well for that. So that's a big reminder. And then again, everybody, keep that 6-foot distance from everybody. Make sure that you're washing your hands often, 20 seconds at a time. Coughing into your elbow or into a tissue, throw the tissue away. All the sorts of good public hygiene things we want people to do. And this includes, as I reminded everybody yesterday, when you're out in a park or something like that, please keep the gatherings to 10 people or less. Make sure you're keeping 6-foot distance from each other, even when you're outside. Same thing at the big box stores. I know, for example, Costco really is kind of the model for this. They've learned a lot, and so they have spaced out people 6 feet apart. They've got people making sure they don't gather in too big of groups. Everybody needs to be doing that as well. Make sure you're practicing that good social distancing. So we got 2 new DHMs we're talking about. I am also in the process of getting an executive order out that will waive regulations with regard to our healthcare facilities. So some of the things this will do, for example, is waive some of the restrictions on our critical access hospitals with regard to the number of beds they have and the time limits they have. Same thing with regard to ambulatory surgical clinics. Generally, they have a time limit on how long they can keep people. We're waiving those time limits. This will also allow hospitals, for example, to have more flexibility with the kinds of beds they can add on, so that will waive some of the restrictions there. We're waiving some of the certifications with regard to nurse aides, medication aides, and dining assistants, so that, again, as long as they're competent to perform their duties, that there'll be more flexibility there to be able to be hired or be brought in to be able to help with staffing in our healthcare facilities. So those are part of the executive order that we've also got out there. So again, basically giving healthcare facilities more flexibility with regard to the types of patients they bring in, the types of beds they have, allowing that to expand, and really making it so that we can increase that hospital capacity here in our state to be able to accommodate the people who will need our care, those older Nebraskans, people with underlying health care conditions, to be able to make sure we can accommodate those in our healthcare facilities. So that's really what this is all about. All the social distancing, all the thing we're doing about healthcare capacity. It's about making sure we have the ability to take care of people who are going to be severely impacted by the coronavirus, and that we can take care of them in our healthcare facilities. So this is why we need everybody's continued compliance on this. So far here in Nebraska, we know that we have not been impacted by it like other states have, but we cannot loosen our vigilance. We need to continue to remain vigilant with regard to these social distancing guidelines, and to make sure that, again, that 10-person rule, which the president extended through the end of April, we are doing that as well. So everybody needs to continue to pay attention to those sort of things, use common sense and good judgment, all that sort of thing. So please continue to do that. Next, we also put out our guidance with regard to nursing facilities and how they should be preparing for the coronavirus with regard to thinking about their staff and people not being available, about obviously most of the nursing facilities, and I think you're talking about this, have already limited visitations to really end-of-life things already in general. But that's part of our guidance to limit those interactions. Part of our guidance will also involve wearing surgical masks for all the people who are working in those healthcare facilities. And then if you have a patient who is COVID-19 positive, make sure they're wearing a surgical mask as well. Surgical masks have been shown, at least talking to folks in the industry, that has helped reduce the spread of the virus. So when we want all of our workers in nursing home facilities to be able to use a surgical mask if they have those available. One of the things we're doing at the state, again, is to try to purchase more of these things to be able to distribute out to our local public health departments and then get those out to the folks who need those surgical masks. So we are trying to acquire more of those at the state. But to the extent that folks have those, and again, you can wear that surgical mask all day long if you need to, as long as you don't like sneeze into it or something like that. As long as you don't do something like that, you can wear that surgical mask all day long. It is fine. It will continue to help protect you and help protect the residents of that nursing home. So again, that's one of our guidelines we want everybody with regard to our nursing homes to be looking to. All those guidelines will be out there on our website, so dhhs.ne.gov/coronavirus. You can find all those there, so please go check that out. So that's kind of the big things that we've got going on with regard to today. Our DHMs that we have issued, that we have a new executive order with regard to the healthcare facilities, and then of course our guidance to nursing care facilities specifically. And I'm going to bring up our speakers to talk about that, and then I'll follow up with some additional things that we want to just get back and talk about as well. But again, I want to remind people, continue to do the social distancing. That is so important to slowing down the spread of the virus. You know, as we expand testing, we are going to expect to see more cases. That's nothing to be alarmed by. But we want to remind everybody, please make sure that you're doing all you can to prevent this virus. Everybody in the state, every Nebraskan can be a part of the solution to slow down this virus here in Nebraska. And with that, I'm going to go ahead and bring up Heath Bodie from the Nebraska Healthcare Association, and then I'll just go ahead and let you introduce Todd, and then we'll give Todd a chance to talk. Does that sound fair? Great. All right, Heath, you're up.
Governor Ricketts, thank you for inviting me today for this opportunity. As the governor said, I am Heath Bodie. I have the privilege of leading the team at the Nebraska Healthcare Association. And a few points I thought I might share with you today: that our nursing facility, assisted living, home health, and hospice members are in a war with this virus. And I'll tell you a few things about why I use the word war, but I use it on purpose. I just want to start out by telling Governor Ricketts, thank you so much for your efforts, for your team's efforts. I spend a tremendous amount of time connected with Dr. Antone and other members of the governor's team. And I have to say, the collaboration and the communication exchange, the ability to search out solutions has been absolutely fantastic. Each day when I watch the governor's press conference at 2 o'clock, he starts out by telling us, like he did today, as Nebraskans, we need to do the right thing by socially getting our social distance from each other. And I would just tell you, when we're talking about our providers that are out in the community, maybe in someone's home, that's super important. When we're talking about a provider that works in congregate living, like a nursing facility or assisted living, the consequences for not doing proper protocols are dire. And there's examples of that across the country. As of yesterday afternoon, we know that 4 long-term care facilities in the state have had COVID-positive customers in their facilities. And I would tell you that while we support those members and help them work through contacting their local health department when there is a COVID-positive test, we're really focusing at the association on a couple of key points. One would be around supplies. As the governor's talking today, about guidance that team members in a long-term care facility need to be wearing a surgical mask at all times. One of the things that we've heard when the governors join with the providers across the state each Friday is that that's been in shortage, and so trying to work through the supplies, when's the proper time to use them. And then on the workforce shortage, and I couldn't be more pleased to hear the governor's thoughts today and his executive order to make more flexible the requirements with direct caregivers, with medication aids, and with dining assistants. It will allow us to train bedside caregivers, as an example, in a much quicker time frame, which will be so much more important as this virus continues to run its path in Nebraska. So this guidance today on a workforce perspective and the guidance that the governor's referring to from the proper health precautions is much appreciated. You know this information changes daily. I just want to tell you quickly a thing that's remained constant in this world. The passion and the enrichment that the team members in long-term care facilities have developed and enhanced with those elders that they're caring for. I've seen great examples, maybe you have too, about using virtual options, iPads and Zoom connections, and ways to connect families and loved ones, because nobody thinks this is an optimal thing that we're doing with social distancing. I would tell you that I think at times the word hero can get overused. But I have to tell you, there's a lot of reflections I have right now about healthcare workers in this environment, staying there, being dedicated, doing the right thing, and that notion of hero follows through for me. I'm inspired by their dedication. Governor, thank you again. I would introduce Todd Stubendick from the AARP of Nebraska.
Thank you, Governor Ricketts. Thank you, Heath. Appreciate it. My name is Todd Stubendick. I'm the State Director of AARP Nebraska. I'm honored to be here representing the 200,000 50-plus Nebraskans who are members of AARP. AARP has been working to promote the health and well-being of older Americans for more than 60 years. In the face of COVID-19, AARP is providing information and resources to help older people and those caring for them to protect themselves from the virus. You can find more information at www.aarp.org/coronavirus. I'd like to thank the governor for his leadership, and I think all Nebraskans can be proud of the bipartisan response the governor and the state legislature have had to this crisis. Let me make 3 quick points today. First, older adults are particularly vulnerable to the coronavirus. While the elderly are the most vulnerable, each of us has a responsibility to help slow the spread of this virus by following our state and local social distancing guidance. Stay at home, flatten the curve, and reduce the risk of spreading this disease to our vulnerable populations. Second, let me say a word to the people who are traveling to Nebraska. This includes our many snowbirds who are returning now that the signs of spring are showing up. If you've been traveling outside of the state of Nebraska in a place where there is coronavirus, please listen to the CDC guidance. When you return home, self-quarantine, monitor your health, and avoid contact with others for at least 14 days. Finally, I think we all need to take a moment and help take care of each other during this crisis as well. Think about reaching out to an older friend or relative and checking in on them. Ask them if they need something. Offer to run an errand for them so they don't have to leave their homes. For people looking for a way to help, please go to aarpcommunityconnections.org. At this site, you'll find mutual aid groups, or you'll have the option of starting your own. And just to explain, mutual aid groups are informal groups of volunteers who band together to find effective ways to support those people most in need. Again, thank you, Governor Ricketts, for inviting AARP to be here today, and thank you for your leadership.
Great. Thank you very much, Todd. And thank you very much for highlighting a couple of those important points with regard to our snowbirds that are coming back here to the state, that they are part of that group that needs to quarantine for 14 days. to make sure, as all travelers who are coming here that are not transitory, our transportation workers are exempt from that, but everybody else that's coming in needs to take that 14 days. So thank you very much for highlighting that. And then also just the opportunity for all of us during this emergency to be able to reach out to members of our community and ask if they need help. So if you've got folks in your apartment building, for example, that you know are older, ask them if they need help. Shoot them a text, see if they need anything. If you're in a parish, be working with your congregation to find out if there's members of your congregation who need that extra help. Again, our older folks, especially those with underlying health conditions, are most at risk. And so we want them to be able to stay home. They may need something. They may need an errand run. They may need some food picked up, some sort of supply. It's an opportunity for all of us to take this opportunity to reach out to our fellow Nebraskans, our neighbors, our friends, our family, and see who needs help. So thank you very much, Todd, for that important message. Also, just along those lines, through our Department of Transportation, our signs that we put up, those Amber Alert signs that we have across the interstates and so forth, those are all reflecting that message now with regard to if you're coming back to the state after having traveled, you need to do that quarantine. Again, this doesn't apply to transportation workers, truckers, railroaders, and so forth, but it does apply if you have been in someplace else in the country, if you're that snowbird, what have you, you're coming back, you're expected to quarantine for 14 days. So please take that advice, be a part of the solution of how we flatten the curve, as Todd was saying. Also, just along the lines of the Department of Transportation, we've been getting questions with regard to road traffic. We do have road traffic has been down about 29%, mostly in passenger vehicles. Truck traffic actually has been pretty stable, just down a little bit, but it's mostly that passenger traffic that is down about 29%, and that's been statewide. So we have been seeing, people who are reducing their travel, staying at home. It is showing up in the numbers that we have from the Department of Transportation with regard to road traffic. I thank you for Heath, your comments with regard to acknowledging our healthcare workers and what heroes they have been so far through this emergency and will continue to be as we look ahead to April, when we know it's going to be a tough month. We expect that if the models from the federal government are correct, mid to late April will be the peak here in Nebraska. So it's going to be a tough month here in Nebraska. We are going to expect to see more cases and so forth, but it will be our healthcare workers who are going to be the front line. So appreciate acknowledging all the great work they're going to do. Have already been very flexible with regard to this. I know that we've got a lot of people working very hard, and we want to acknowledge the work they're doing. It is also National Social Worker Month as well, and so we want to thank our social workers who will also be a part of combating this pandemic and thank them for their great work. We had a question yesterday with regard to having a birth in Omaha and whether or not a birth assistant was going to be allowed, and that partner is going to be allowed in, that husband or whatever, and the answer is yes. So in Omaha, they are allowing one person to be able to come in for that. We've gotten questions from landlords with regard to the executive order I wrote on evictions, and I really want to, first of all, say to the renters out there, again, this is not a prohibition against you getting evicted down the road. This is a deferment. So we're saying during this emergency, and we are deferring that, the fact that courts don't have to act on this until after May 31st, but it does not get you out of paying rent. It just is an acknowledgement that if you've been impacted by the coronavirus, you've lost your job, you have to stay home with kids because they're out of school, or you're taking home of a loved one, or maybe you're quarantined yourself or sick, whatever the reason, if you're impacted by coronavirus, then this is a way to help defer that. But again, you're still going to be responsible for paying your rent, but it will be a deferment during this emergency. For the landlords out there, yeah, what I'd recommend is work with your renters, have good communication going back and forth, try to work out plans. And I think I commented last week, I know there's a landlord here in Lincoln that has cut their rent to all their tenants this month, or for the month of April. So that's something that you can take a look at, but also reach out to your banks, work out if you've got loan agreements with them. Also, as a small business, you're eligible for that SBA loan that's out there. Again, you can go to www.sba.gov/disaster. There's because we are a disaster state for the Small Business Administration, there's loans out there up to $2 million, 30-year loan, 3.75% interest rates. You will have to have your financials, so you'll still have to talk to your bank to pull all that together. But another option for you to get liquidity during this emergency. So for our renters and our landlords, have kind of got that advice out there that we've talked about in the past. We also received questions with regard to the CARES Act and what that means for unemployment, specifically here in Nebraska. And again, I think I said this yesterday, but I just want to remind people again, So this is specifically about trying to help out people who are impacted by the coronavirus. People have been laid off through no fault of their own. So yes, there will be increased payments because of the CARES Act. And if you qualify, we encourage everybody to apply for that. And this will cover groups that are not typically covered under unemployment. So there's sections, as we talked about yesterday, will cover people who are self-employed or those nonprofit folks and so forth. But if you have a job, do not quit. Because in Nebraska, if you quit your job, you will not be eligible for these benefits. It's something for people who have been laid off because of the coronavirus, not for somebody who has quit. So I want to make that very clear. And if you have been laid off and your employer calls you back to work and you choose not to go back, you will also have deemed to have quit, which means you will no longer be eligible for those benefits. So again, I want people to be making good decisions about this. If you have a job, do not quit. That will not make you eligible. You'll be ineligible for those unemployment benefits. So if you have a job, don't quit. This is about people who are being impacted by coronavirus and are being laid off involuntarily. So just want to make sure we're addressing that specifically. Today is also the day that we are doing our blood drive at the state of Nebraska. I want to thank all the Nebraskans who stepped up after last week's press conference to contact the American Red Cross to donate blood. I've heard from Wason Dunn, who was with us last week, that we have seen a great number of increase in people wanting to donate blood to the American Red Cross. We filled up all of our slots for our state teammates today, and so I'm very proud of our teammates and the way they stepped up to be able to help out the American Red Cross and donate this life-saving resource. And in fact, we had so many people volunteer that we are going to do another blood drive on April 3rd to be able to, again, donate more blood and help out our teammates who are willing to donate their blood but couldn't do it today. So again, great response from our state teammates with regard to giving blood. So I really appreciate everybody's great work around that. And then now, okay, where's Taylor go? All right, Taylor. So I'm ready to get into the questions here. Was there anything else I'm supposed to hit before I got into our questions that were emailed in? Oh, thank you very much. So Taylor reminded me about another executive order that I signed, had to do with turkey hunting permits. So we issued turkey hunting permits to people who are out of state. I signed an executive order working together with Game and Parks so that those we will no longer issue permits to out-of-state people to come turkey hunt here in Nebraska. We've got the best turkey hunting state in the country. I think you all know that. I proclaim it every year. Nobody's ever said that I'm wrong. But this year is not the year that we're going to be promoting that outside the state. So Game and Parks will work with those out-of-state folks that have already purchased a turkey hunting permit to issue them a refund, and we will no longer be issuing permits to out-of-state folks. Again, it just makes sense. If we're asking people to come here and quarantine for 14 days, it just doesn't make sense that they're going to come here and quarantine for 14 days and then go turkey hunting. We want to just really kind of nip that in the bud, so we're not going to be issuing those out-of-state permits. And then also I want to remind all hunters, again, even when you're out there in the blind, make sure you're continuing to practice good social distancing. You're probably, if you go hunting with somebody, you got to stay 6 feet away, all that sort of stuff. We want to continue to make sure that we're practicing good social distancing and all the other things that will help slow the spread of the virus. This is one of the things that will do it. Obviously, in-state residents will be able to get turkey hunting permits, and so we expect to, still have Nebraska residents have access to that. And so with that, I'm going to go ahead and get into the questions. So Andrew Lacey of KBRY asks, with community spread now confirmed on both ends of the state, at what point does the current patchwork approach need to give way to a more proactive statewide approach before people are infected rather than after? Before people are infected rather than after? Okay. With only a fraction of the people who have symptoms able to be tested, especially outside the Lincoln and Omaha area, is it not reasonable to assume that the virus has already reached most of the state and act accordingly? So again, Andrew, so we've got a plan that we put together beginning of this month with the experts at UNMC who are world-recognized experts in infectious diseases. Part of what that plan recognizes is that the virus will actually not spread at the same rate across our state. It will be in some places sooner and other places later. And that's what our plan really recognizes, that what we're doing is a regional approach based on public health department to be able to issue those directed health measures when we have those cases of community spread. And again, community spread is defined as people who we can't figure out how they got the virus. can't trace how they got it. You know, if they travel related, and we understand that doesn't count. But for those folks that we can't figure out how they got it, that's where we're using our benchmark in those public health districts to say the virus has reached the point where we need that directed health measure. So rather than the way you framed it, which is a patchwork approach, what this is a regional approach that recognizes that it will, as Dr. Lauer used the term, be asynchronously spread across our state. It won't be spread at the same time. And so we'll take these directed health measures as we need them. And in each place, you know, we've put them in for roughly 6 weeks. So where we had that community spread in Omaha, and we have the directed health measure going till April 30th, now in the Panhandle, it's going to May 11th. So you can see because we reached that threshold later, theirs is going to go a little bit later as well. So this really is a tailored approach based on region across our state. Not every part of the state is going to be impacted the same way at the same time. And what we really want to do is make sure that we catch it in time, but also not to go too early. Because if we go too early, what happens is people may get tired, they may stop paying attention to the things we're asking them to do with regard to the washing your hands and the 6 feet social distance, physical distance, you know, that sort of thing, the limiting groups to 10 people. We want people to make sure they're paying attention to all those things as the virus is starting to surge in their communities, because if they get tired and stop doing it, that's when we could see it really spike up. So it's important to try and time it in each community for when we see the virus starting to spread. And that's why we've taken this in a regional approach. And that's the plan we put together, again, at the beginning of this month with the world-leading experts at UNMC. So we will continue to follow that plan with regard to looking at each public health district. When we have that community spread case, that's when we'll issue a DHM and really tailor it for that region so that we're timing it as best possible as we can to when we think the spread of the virus is there. And then just one other thing with regard to testing in our rural communities. If somebody is meeting the same criteria that we have, whether it's in Lincoln or Omaha or Scottsbluff or in Hastings or wherever it is, it's really around those high-risk folks that we're testing first, which is, again, if you've got the symptoms of high fever, coughing, shortness of breath, and you're negative for the regular flu symptoms or regular respiratory disease, and you've traveled either domestically or internationally, or even associated with somebody who is known to have the coronavirus, those people will be tested whether they're in Scottsbluff or in Omaha. And in fact, if you look at some of our rural counties like Gosper, Nemaha, Knox, that's how we found those people. So they're being tested along the lines of that criteria. So even if you're in a rural area and you meet those criteria, you will be tested. There's not a lack of testing for those high-risk folks. We will make those a priority to get tested. Now, we will also be looking to expand that testing to healthcare workers and people in nursing homes and nursing care workers as well. And as we do that, we will look to do that again, find ways to be able to make sure that happens statewide. So stay tuned as we get more down the road of that path and expand more of that capacity. We will be doing that as well. Okay, that was a long-winded answer, probably way more than Andrew was looking for. All right, next we're going to Andrew Osaki from KETV, who, Andrew, you're not here, right? Okay, I don't see him. Last time he cheated and asked questions online and then showed up. What more can be done to help nursing homes and assisted care facilities stop or mitigate the spread of COVID-19? Timely question, Andrew, but I think we kind of covered that already with regard to the guidance that we put out there. Our executive order with regard to loosening the restrictions on nurse aides, medication aides, dining assistants, all that sort of thing will help nursing homes be able to staff up and kind of flex in people as some of maybe their workers are exposed. The guidelines we put out specifically today around wearing masks and cleaning, doing all the good cleaning and all the other good hygiene stuff, that guidance is out there at dhh.ne.gov/coronavirus. So all that guidance is out there. Okay, where are we getting masks and PPE to those workers to protect themselves and their residents?